In Namibia, antimicrobial resistance AMR is a major public health concern. Annually, almost 500 deaths are directly attributable to AMR, with 1,900 deaths associated with resistant infections. To amplify the voices of AMR survivors, Africa CDC and the Ministry of Health Namibia have partnered to share the stories of loss, resilience, hope, and recovery.
My name is Susanna Tamases. I was admitted in the hospital and diagnosed with TB. I lost my husband, and I also lost my child through TB.
It was a very emotional journey to be in the hospital because I was never sick. I was about an outside back room. I didn't have any support from family or friends. It was something new to me to accept.
This is the beginning of our problems in our setting, is that every infection is treated with antibiotics.
Every day, millions of people depend on medicines to keep their families and communities healthy. But what if those medicines stopped working?
The first time that I went getting TB in 2016, so it was on my lungs. My lungs was having water, so I got sick. So I was feeling weak. I was losing lots of appetite, and I was also losing a lot of weight. So on that process that I'm on in the tablets, even the skin was also affected, same as my hair. So if I don't drink my tablets, there's no way to live. So if I want to live, I have to take my tablet. But you can't drink your tablet with an empty stomach. If you drink your tablets with empty stomachs, there is a certain of a feeling that makes you vomit, certain of a feeling that makes you are getting crazy, that you need maybe to see a mentor. So when it's come to that, then you as a patient, you make a decision, I will not take this medicine. The doctors are saying, take your medicine, and if you don't drink your medicine, then you have to repeat it. But in the process, I was not alone doing this. I was doing with my husband and with help of Ohomkwena people. But on the long way, I also lost my husband. It was not easy for me, but I got strength from God, and I am now a survivor of TB.
Our biggest problem is that the bugs have grown to outsmart the antibiotics. So the bugs have evolved, and the number of resistant cases has increased. So we have a lot of antibiotics that cannot help curb this problem, as the bugs have gone resistant to them. Back in the days, we used to have patients that would come in with bugs that would treat and would easily be sent home. Now we have a lot of prolonged hospital stay. We have patients that are running out of antibiotics to use to treat these bugs that have now grown to outsmart the antibiotics. We are running out of options to give to the patients. So that's the current problem we have, and that's what patients face. In that case, we have disease progression that is faster. We have people that become critically ill, and people can die from a common infection that could have been treated back then easily by what are common antibiotics, but now require more extended spectrum antibiotics.
I just started getting sick with night sweats, cough, and loss of appetite. And I was just ignorant. I just started using traditional herbal medication, which was wild dagga, as they say. And I just continuously using it. But then the cough and the symptoms never went away. And not knowing that I was infected with TB, I was immediately helped and then diagnosed on the very first day and then admitted as well. And the doctor told me what TB was. I had no idea what TB was. I just knew it's TB, not having to differentiate between a general TB or an MTR or an XDR TB. So I was told I was diagnosed with an MTR TB, which is multi-drug resistance.